Hello, everyone, and welcome to Public Health Musings. I'm your host, Dr. Caroline Kingori. I'm so excited to have you back to listen to a new episode for this month. And we have an amazing guest with us today. I'm so excited to be talking to my friend and a recently, I would say, graduated PhD scholar at Ohio University. We're very excited for his achieving this goal. So our guest today is Dr. Aggrey Willis Otieno, who's a communication for social change scholar and has a PhD in mass communications from the Scripps College of Communication at Ohio University. He has over 18 years of work in the development field and also championing social change in Africa and the US, especially where child protection, promotion of social justice, and health is concerned. He's currently working as an adjunct professor at the School of Media Arts at Ohio University. He has worked extensively with international development organizations, focusing on empowering resource constrained communities and promoting child and human rights, good governance, and health promotion, has won several awards that count for his professional work. For example, in the year 2016, he won the Excellence in Global Leadership Award. And in 2013, he won the African Children Hero Award. And in 2012, he was the Rolex Laureate. So he'll tell us more about that. And when we think about his academic and research work, it focuses on the intersection of underrepresented communities, race, technology, social justice, media innovation, and activism. And he makes use of big data and analytics to understand the effects of new media on society and organizations. So again, he'll give us more information about that. He has co-authored a number of publications, focusing on child and women's health, also on health communications improvement. So join me in welcoming Dr. Aggrey Willis Otieno to the show. Yay!
Thank you so much, Dr. Kingori, for having me, and hello to the viewers and listeners.
Awesome. So tell us a little bit about yourself. I mean, I know your story, but it's such a compelling story. And I would like for the viewers and listeners to know how you got to where you are today. You have achieved a lot despite the challenges that you faced. So tell us, how did you get to this point? You know, what do we need to know about yourself?
Yeah, I'll start by saying that I was privileged to having been born in the third largest slum in Kenya, known as Korogosho. So basically, Korogosho, I'm informed, is a Kikuyu word that technically means something that is not of value. So that is how people used to see us when we were growing up in Korogosho. We lacked several opportunities. There were no social amenities. There were no public schools. There were no health hospitals. And the housing condition was not very good. And because of that, I even ended up starting school late. And I can say that the experiences that I had in my life, especially in childhood, and that is why I'm saying that I was privileged, because I say that that is the first degree that I got at Korogosho University of Life. And that informed part of the things that I'm now doing as an adult, because as I was growing up and I started addressing some of the challenges that we were facing as youth at that time. And that is how I found myself now going into child protection issues and also going into communication. So I remember when I was a high school student in 1990s, I did my Form 4 in 1997. And what happened is that textbooks were really expensive for me. And given that my mom was not working, going to her, asking her to give me money to buy textbooks was a little bit challenging. And what we did together with others in Korogosho was to look for a space where we can do studies on our own and also ask other people who've gone through high school to donate books, all books that we can use. And we reached out to a Catholic church, St. John's Catholic Church, and the priest at that time, Father Alex, gave us a small room, and that room ended up becoming a community library. And now as we speak, it is a two-story building, permanent building, that is housing over 400 people at any given sitting. So in other words, we ended up now going into that making it a big project. And we fundraised, so UNIFEM chipped in, ActionAid, and so many other donors. So it is a long story, but in short, it became a big project. So I ended up doing it to address the challenges that we were facing. There are a number of governance issues related, especially people in the slum communities. They face systemic discrimination, and that explains why some of the things that people are experiencing there, they're experiencing because the government is not even allocating resources. And we started going into governance issues. We have public funds in Kenya. For example, CDF, we have, during those days when I was young, LASDAP, which was managed by councillors, and many others that were not properly managed. And we ended up now going into that area to do a lot of governance. Then health issues, also cholera outbreak that ended up killing about 100 people in Korogocho. And I found myself going into health. And that shows why I'm focusing on those three main issues: child protection, health communication, and social justice.
Wow, that's a very amazing story. And to see you championing activism is definitely commendable. So you consider yourself a champion for social change, and you've sort of gone into that a little bit, but what does that really entail? What does it mean to be a champion of social change?
Good question. So in the societies that we live in, there are a number of social and behavioral issues that when they happen in the community, they end up denying us rights or some things that we should have enjoyed like normal human beings. So like I've alluded to, when you are in the slum, you don't have social amenities, or it could be things to do with bad governance because that is a behavioral issue that is systemic within a country, or it could be individuals' behavior that makes them not to live healthy ways of living so that they can take care of their health. And a very good example right now is we are in a COVID-19 pandemic era. And there are a number of behavioral issues that people were behaving normally before, but now we have to change so that we mitigate against the transmission of diseases. So basically, I see myself as a communication for social change specialist and scholar in that regard, and also a champion for social change because, like I have said in the introduction, I am going into the mix of things to partner with other people so that we can see how do we influence the society to behave positively in addressing social ills that are affecting other people in the community, and how do we also work with individuals within those communities so that we can also inculcate values and positive behavior change that can make them, especially in my regard, make them to protect children, especially make sure that child rights are protected, to make sure that people are living healthy lifestyles, and also to make sure that they are good governance and respect for human rights for that matter.
So I appreciate that perspective. And in your work, how do you then convince people to make these changes? You know, you're trying to create awareness and you're trying to let them be, you know, sort of responsible and accountable for their actions. But we are thinking about communities that are really disenfranchised. How do you let them, you know, look at things and accept that there's a change that needs to happen to improve their health outcomes?
Yeah, good one. So I've said I'm from Korogocho University of Life, and that means that I have lived experience. So I've also gone through the challenges that people are facing within these communities, and that became my starting point. And for example, I'm among the very few people who've been able to access school during my childhood, and many others were not able to go to school. And people have been able to see through my lived experience that going to school adds value in people's life. Now I'm a doctor, and actually you're the first person to formally call me a doctor. So it feels good to be called a doctor. And during my dissertation defense, a big number of people from Korogocho came online to witness it because it is a huge thing for them. And because now people can see me living the change, then it becomes really easy for me to start impacting change on other people. But again, the most important thing is to come up with participatory strategies that you engage people and you discuss with them. We call them community conversations. So we've had so many community conversations inside and outside Korogocho, where we start talking about challenges that people are facing. And then we identify the felt needs that people are facing in those communities. We identify who are the most important people that we need to involve from their from the beginning of the initiatives that we want, and what are the best solutions given the kind of locally available resources that we have. Resources in terms of finances and also in terms of human resource. And the moment all that is done, community planning is already taking place. And we're now going into full swing in terms of implementation. And we demarcate to give each people roles and responsibilities to do. So most of the time, what I usually do is I don't sit on the driver's seat that, hey, I'm Aggrey there championing for social change, so I'm the one who's directing everything. So I behave like a shepherd. So when you see a shepherd taking care of animals, they are grazing, the shepherd doesn't stand in front. The shepherd is behind. And that is how I see myself. I facilitate the process. I give people the opportunity to be the drivers of their own change. And because of that, we've ended up coming up with so many initiatives that have been sustainably managed and implemented up to now with positive deliverables. And one example that I gave you is the community library that we have now, which is a 2-story building. And I'm no longer part of the team that is managing it. It is managed by the church with the youth from Korogocho. We ended up having in 1999, I remember in December, so many girls in Korogocho were raped. There are a high number of gender-based violence going on, especially defilement of children, rape of women, and other violence-related things. And one of the things that we did together with the community is to come up with a concept that we called Miss Coach. It is just like Miss USA, Miss Kenya. So we did a beauty pageant in Korogocho as a strategy to mobilize people, but again, it became a conduit for positive social change and also a platform to give girls an opportunity for them to be the drivers of their own change. And because of that, the winners ended up becoming the mouthpiece of that community, and we ended up raising a lot of resources, and through it, over 1,000 girls have been sponsored from Form 1 to Form 4. And some of them are now working abroad and they are professionals. So that one has been sustained up to now. We've had the health programs that we've initiated. In 1997, we had a huge cholera outbreak in Korogocho that killed almost 100 people. That is the challenge that made us now to start thinking of communication. So cholera is a public health issue that is related to hygiene. So how do you make sure that you wash your hands all the time, you boil water and drink good water? There are things that people can do, no matter how poor you are. We just need proper information on how we need to go about it. Then we asked ourselves, how can we make sure at a large scale that people have this kind of information? And that made us to start thinking of community media. And we came up with Korogocho Mirror. Unfortunately, it is no longer there. But after about 2 years of implementation, we have Coach FM, and Coach FM radio station is there up to now with an audience of over 1.2 million slum dwellers in Nairobi. So basically, I see myself as a facilitator, giving people room to be the drivers of their own social change.
Wow, that is absolutely incredible and speaks to your mission and vision to empower these disenfranchised communities, and focusing again on children and human rights and challenging the policies in place. I mean, after having, done all these things and come up with amazing initiatives, what kinds of challenges did you experience trying to develop and trying to rally the communities to work with you, even as you were shepherding them, as you said, even as you work as a facilitator? What kind of challenges did you face?
Yeah, so we experienced so many challenges. Some were life-threatening, others are normal challenges that you will face in a community and you address them. Others you are never able to overcome them. So, for example, most of them are funds related, because when you want to reach so many people at scale, then at some point you need good amount of money to do it, and you don't have access to it. And sometimes we didn't even have the expertise to engage people outside our community, outside the country, and to reach this kind of resources. Of course, over the years, we built our skills, and now I can say I'm a PhD holder, and I have the skills to do proposals and all those things. But when we were starting these things, we didn't have those skills. We didn't even know how to do proposal writing. So those were some of the biggest challenges. But again, when we started delving into advocacy issues, especially good governance issues. I remember there was a time somebody used administration police, and they ended up putting padlocks in our offices. And we had to do a lot of advocacy. And one of the things that they did together with the area chief at that time was that we are a threat to security. And they said that the compound where Coach FM is hosted, there is an administration police camp, and they have armory there. And the kind of people that you are attracting to come to initiatives, some of them were criminals. And so it is a threat to the police. And they feared that they could be attacked and guns will be taken away. And actually, that was an excuse. And that became one of the biggest challenges that we faced in the community. Of course, we had skills. We had the people with us. We mobilized people. We met the then PC during those days when we still had PCs in Nairobi. And we ended up being given the opportunity to continue staying there. Actually, it was say if it is anybody to move from that company, it was the chief to move, because that community was donated to the Korogocho youth by Action Aid at that time. So that is one challenge. The other one is when we started focusing on governance issues, especially focusing on misappropriation of funds, public funds, like LASDAP, which now is World Fund, and CDF, which now is the National Government Constituency Development Fund. So when you spotlight on these politicians, they are not happy. So one of the things that they did actually is to send people to beat us up or even to harm us physically. So some of these challenges are big. Some of them are small. When I started focusing on child trafficking issues, we ended up now rescuing so many children. We worked with the police and law enforcement so that perpetrators of trafficking could be arrested. Some of them got arrested. They got bailed. You know, in Kenya, any offense is bailable, including murder. So you can kill somebody and you can still go back to the community. And this means that witnesses that we're working with started getting some threats. And actually, some of them, we had to organize for them to go to exile. So at some point when I was going into governance issues, trying to run for politics, at some point, I actually got poisoned. So you can see all these challenges. But again, I'm glad that together with the community, so long as the community understands what you are doing, they will be there to back you up. And I'm glad that the communities that we've been working with, because now my initiatives have transcended the Korogocho where I was born. So we have projects all over the country. So I can say that I've been privileged to move to so many places in Kenya and outside Kenya doing this kind of social change. And the moment you involve people and people understand what you are doing, and if you receive any challenge from whatever corner, people will be always with you to support you.
That's awesome. And I want to piggyback on, how you started talking about your cause for preventing child trafficking. So, like I said earlier, you graduated with a PhD in mass communication and you focused on child trafficking. So let's talk a little bit about that. Could you tell us more about this interest in that line of research, knowing how complex it gets in terms of talking to the survivors, and even in trying to come up with some recommendation? Tell us, about your research trajectory.
Yeah, thank you. So first of all, in layman terms, child trafficking is where you take a child. You don't have to move that child from one place to the other, even within the same community. And your intention is to exploit that child for your own benefit. So for example, when I talk about this topic in Kenya, one of the things that I usually ask people is, how many of you in this room are having maids, domestic servants, who are below 18 years? And you will find so many people raising their hands. Actually, those are child traffickers, because anybody who is below 18 years is a child. And where are they supposed to be? So 18 years are supposed to be, below 18 years are supposed to be at least in high school. So this means that that child is supposed to be going to school somewhere. So exploitation can be in terms of labor. So many people are being exploited as domestic servants. It could be sexual. So we have child sex workers, especially at the coastal region in Kenya. It could be even life-threatening, like organ harvesting. And it really happened this year and last year. And we've had a number of children, especially those who are albino, who've been trafficked to other places, including outside Kenya, for witchcraft and organ harvesting, and so many other exploitations. So because I've had interest in child protection, and I've done a number of interventions in that regard, then I realized that the mother of all child abuses is actually child trafficking. Child trafficking is the mother of child abuses because a victim of child trafficking goes through all levels of child abuse. They get physically assaulted, so that is physical violence. They get emotionally assaulted, so that is emotional violence. They have a lot of neglect, like now we have COVID-19 pandemic. You can imagine a child who is a victim of trafficking is somewhere and nobody is even bothering to take them for vaccination. So they do not even access medical services and all manner of things. And that is why I decided perhaps if I focus on this, child trafficking issues, then I'll be now focusing on all the other abuses that children are facing. And in Kenya, children are being trafficked at a very high number. The statistics that we have are underreported, mainly because it is a hidden crime. And that is why now we started talking about these things, I think about 10 years ago. And I'm glad that the efforts that we've had in partnership with other people, non-governmental organizations and government agencies. Now we have the Trafficking in Persons Act that President Kibaki assented to it became in operation in 2012. I was part of the National Steering Committee at that time. And we pushed for the first National Action Plan that expired in 2013, unfortunately. And up to now, I think we still have negotiations and discussions around the new National Plan of Action. So I ended up being part of the conversations and part of the individuals in the country that we've been doing this. And we've done a number of capacity building, so many awareness raising. But as we did awareness raising, we are still not reaching people at scale. I was still really, really challenged and disturbed that you are still not doing our level best. And that is why when I came here at Ohio University so that I can do PhD, I said, why can't I now take my time to study these things deeper? And because I'm more of a communication person, and these things rotates about communication, especially like you've noted communication for social change for that matter, then how do we make use of communication strategies so that you can reach people and instill behavior change in them? And that is why I started now focusing on my dissertation. And I looked at specifically the use of technology and also social media. How can we make use of this? Because one of the things that we faced in Kenya is you do awareness raising. And most of the time you will find NGOs going to community X, they do their kind of awareness raising. You mobilize 10, 20 people or 50 people. You cannot reach so many people. Or you do community theater and you get about 100 people and you say you've done awareness raising. But again, how many people have even accessed that information? And again, you do it in an ad hoc manner. It is not well organized. And so we find so many people are still not aware about these things. And right now we are going into the technological era where so many people, almost 80%, are now accessing internet in the country. A big number of people in Kenya are accessing smartphones. And because of this, children within the homes, they are also accessing this kind of smartphones, and they are able to be online. Now we have COVID-19 pandemic, and because of mitigation measures that are in place, like social lockdown, social distancing, kids are not going to school, everybody is going online to study to some extent, then that means that kids are even more online. And now as we speak, it is being said that globally, we have 750,000 pedophiles who are just online at any given time waiting to take advantage of children. And so I said, perhaps my dissertation can focus into this so that I can study what kind of technologies, emerging media technology that are there that can, these child traffickers are taking advantage of to target, groom, and traffic children. But at the same time, what other technologies can we make use of so that we can counteract what the child traffickers are doing? And that became the focus of my dissertation. Then the other thing that I looked at is making use of data analytics. What kind of conversations are people making use of, especially those who are addressing these things, and the general public, especially social media users in Kenya, and what kind of conversations are they using? And I took that as a case study for me to develop a model. And this model, I believe, the moment I'll start publishing articles and talking more about it, I'm calling it CPROG model. Perhaps it could be a model that can help people to start addressing these issues at large scale. And because of that, now I was able to come up with CPROG, which have different components. And the most interesting component, which already people are doing in the country, is what I call the 5P framework. So this is where, as I was saying, all my initiatives, you have to involve people. So when you involve them, you must have a formula. You don't just go and involve them for the sake of involving. And one of the things that I'm advocating within CPROB is the 5P approach. So when you are diagnosing the problem, the first P is prevention. So what are the prevention issues? What are the things happening in this community that are making this thing not to be prevented? So it could be ignorance, it could be poverty, it could be policies not being implemented, and so forth. What are the protective issues that are making victims not to access services that they need? So perhaps there are no shelters, like as we speak right now. I know of a place in Nairobi. If you go to Kiamaiko, there are at least 300 victims of child trafficking from various parts of Kenya, and some are from Ethiopia. If you read reports, a USIP, United States Trafficking in Persons report that they publish every year in July, I think the report that was in 2019 or 2018, they documented this, 300. So when I engage the police, for example, they'll tell me, Aggrey, now we have the intelligence. We know where they are. After rescuing them, where do we take them? We cannot take them to police cells. We cannot. Where do we take them? And that becomes a challenge. There are no shelter for boys, especially. We only have one shelter, which is managed by the Department for Children's Services in Kabete. And that one is for girls. So you see, now those are protective issues that we need to look at and see how do we address it. Then we have policy issues. So what kind of laws and policies do you have in place that makes this problem to perpetuate, either because they are not being enforced or because of corruption? And what do we need to do? So that is the third P. Then the other one is prosecution. So now we have traffickers. Are they being, investigations are done properly? Are they arrested? Do you have proper evidence? Are they being taken to court? If they are taken to court, are they getting jailed? So those are the big things. Then partnership. So most of the times people work in silos. So you see Aggrey has his own NGO doing his own things in a small corner in the country without talking to other people. And that explains why even data, ask anybody in Kenya, including the government, how many victims of child trafficking do you have every year? They cannot tell you, because either people are duplicating data or people are underreporting. So under the 5P approach, then it means when you talk about all these things in terms of even doing research and even in terms of designing interventions, then we are taking advantage. We are considering all the facets of addressing and coming up with intervention. So CPROB, I know later on, it is not a forum for me to talk about it, but those are some of the things that my dissertation focused on, and I believe that I'll be able to add some value in the good work that the other actors are doing in the country and globally.
Indeed. And so, you alluded to some of the challenges, like underreporting or duplicating of data. What is Kenya doing overall? When you're thinking about good governance, what are they doing to address child trafficking? And what else can be done, especially when you're thinking about shelters, and you talked about young boys not having shelters? What can be done? What are those practical solutions?
Good ones. So I am glad. Now, US government usually monitors these things and they come up with a report. And that report ranks different countries. So it is a 4-tier process. So we have third tier, which is a country that is doing nothing. They are not acknowledging that trafficking happens within their borders, and they're doing nothing. And most of the time, these are countries that are in war, for example, Somalia. So there are no government actually to even monitor these things. Then there is the Tier 2 watch list, which is the second last. And Kenya was in Tier 2 watch list for over a decade. And this is because, so those in Tier 2 watch list are those people who have acknowledged that this problem is happening, but they are not doing things that they're supposed to do to mitigate against it. And Kenya was in the watch list for so long. So being in the watch list means you are in a list where the US government is actually watching you if you are making any significant efforts. And for those who are in Tier 3 and Tier 2 watch list, most of the time, if you are to do partnership with the US government, they can even decide they're not going to fund you. They're not going to have any positive relationship with you. And that becomes a deterrent for people to continue being in those tiers. So right now, because of the efforts that we've done, Kenya got promoted 2 years ago. So now Kenya is in Tier 2. But Tier 2 still means you are doing efforts. You've acknowledged this problem exists and you are doing efforts, but they're not significant enough to curb this problem. Then we have Tier 1. And tier one now has countries like USA, where the problem is there. You are doing very good efforts. We have very good system to address these things in as much as it is still going, but those efforts are sustainable. So in Kenya, one of the things that Kenya did is to come up with the Trafficking in Persons Act 2012, which came into force in 2012, and it is still up to now going on. So through the act, then it means that you formulate policies. And these policies now, one of the things that Kenyan government needed to do is to come up with a national action plan. So through the national action plan, even human beings, even you and me at our homes, if you don't plan for your house in terms of means that you are going to use, then it means you are planning to fail. So as a country, we thought that having a national action plan is actually going to make us to deal with the real issues and the felt needs and allocate resources to address those issues. So we came up with the first national action plan, which was never implemented, zero. Why? There was no political goodwill. The government of Kenya came up with the Trafficking in Persons Act, and it was put in the shelves. The police were never trained on it. So when you go to the police and you tell them, hey, trafficking, they'll be asking you, what is that? But right now I can say, because of the efforts that we did, now they know that Trafficking in Persons Act exists. But now the other challenge is, okay, so we are going to arrest somebody. Aggrey, you have intelligence that so-and-so is trafficking children, but they are not gathering evidence. And one of the things that we've learned that is making the prosecution not be proper the way we thought is that there are levels of evidence that the police must gather. And these levels are really challenging for them to produce evidence in court. And because of that, so many traffickers are going scot-free, especially child trafficking and even the trafficking of adults. But I can say that these efforts have been going. So people and interventions are there. We have the Counter-Trafficking Advisory Committee, which President Uhuru Kenyatta the other day gave them some budgetary allocation. So they have about equivalent of $600,000 to do their things on an annual basis, which is still a drop in the ocean. But as we speak right now, the second national plan of action that was developed expired in 2017. And we are in 2021, we don't have a new national plan of action. So you can see, in as much as we are acknowledging this problem, we are still not doing significant efforts to address it. But now when we go to the community, the meat of the thing is many people are still not reporting things to do with child trafficking. So one, perhaps they're not even aware about the signs. Or if they are aware, what do we do? Who do we report to? If you report, like I told you, if you go to some places in Kenya, we know where the victims are. I know where there are 300, for example, potential victims of trafficking. But if you go to the police, they'll tell you, where do we take them after rescuing them? Because there are no support mechanisms. So those are some of the challenges that we're still facing. But I can say it is not as grave as it was some years back. We are making progress, though in my view, it is in a very slow pace. I think we can move a little bit faster to make sure that we protect children and prevent trafficking from happening.
Wow, that is some interesting information, but also, a little bit discouraging when we think about these children and the slowness of the efforts and the policy measures in place. But what can a lay person do? If you want to be an active bystander, how do you identify a child who's being trafficked? But also for people who would want to maybe donate or participate in, financially in helping to come up with resources, what can people do?
Good question. So first of all, I'll start with the signs. So we have telltale signs. I cannot say that they are rocket science that, this is social science. So if it is malaria, we'll say when you feel that you are feeling cold, you have these symptoms, then we know it is malaria or we know it is COVID with certainty. So, but we have telltale signs that when you see a child exhibiting, then that can show you that something is going on here. So for example, you are in your neighborhood and all of a sudden you realize that there's a new kid that is within the community. And this new kid, you can have a look at the kid and you can tell this kid was from a very good upbringing, the way he looks healthy or something. But you can look at the clothes that they are wearing, they are tattered, they are dirty. And most of the time, this kid is not even allowed to mingle with other kids. They are isolated. They are indoors most of the time. That is a very big red flag. Then the other one is when you see a kid within your midst who cannot speak the same language like yourself. So that means there is a problem there. Or when you try to reach out and talk to the kid, they are afraid most of the time. It means they are emotionally disturbed. They have physical marks on them. It means they are going through some physical violence as well. Or you are engaging them and they do not want to speak because they've been told not to speak to people. So that is a telltale sign. So the moment you see these kind of signs going on, another thing is kids need to be at school. So you see a kid who most of the time is just idling around, not going to school, and the people living with that kid are not biological parents. Then that is another red flag. So what we usually encourage people to do in Kenya is, as a bystander, call 116. So 116 is a toll-free helpline that when you call, they'll be able to advise you on what to do. What I usually tell people, don't go and confront. You know, sometimes Kenyans like confronting. So when you confront, you put your life at risk. You can be beaten up. Sometimes Kenyans like going to intervene and they take the kid away. If they take the kid away and the other person goes to the police, it will be like, now you are the trafficker. Things can be changed on you. So I usually tell people, call 116. The moment you call 116, the system is there. The child protection system in Kenya is good. They will be able to know where you are. They'll be able to talk to the child protection officers. We have children officers all over. And these children officers, they are in each sub-county. And we even have volunteer children officers in each ward. So that is how close they are with the people. So the moment you call 116, they will know who is the VCO, and the VCO will talk to the chief. You go to the chief, and the kid will be rescued. They will determine if the kid is an actual victim of trafficking or a victim of other abuses, and they'll be able to intervene. They are going to also come up with the rescue plan to rescue that kid and to see how that child will be supported. And if there is need to gather evidence to prosecute the person who was meting out these abuses, then that will be done. So as a bystander, I usually say that when you suspect, call 116 and they will deal with it. Or if you are not able to call 116, and actually it is free, you don't even need to worry that you are going to pay airtime. But again, you can also go to the police and record this matter. But call 116, very important, because sometimes we know people go to the police and these people work with the police because of corruption, and then you end up becoming a victim of so many other things.
Yeah, those are really good signs and opportunities to be able to see if a child is being trafficked. But I'm wondering, knowing the communities in Africa, we are always taking care of other people's children, as extended families. Also, children are directed not to talk to strangers. So then how do you differentiate? Do you just call 116 anyway? Or how do you determine that this child wasn't brought from, from the rural area and is now living in Nairobi because there's need and the child is not talking to you because they don't know you? How do you differentiate that?
Good point. And I really like that you brought this up because it has been the root cause of some of the challenges that children are facing. Some people do it with very good intentions and they support kids and they live with them just like their own kids. But some other people are taking advantage of that system to abuse children. And actually, some of them are trafficking children. A good example is we have orphans in the village. The moment you have orphans, what people will do is so-and-so is now an orphan and is really, really struggling with life. Let us bring him or her to the city. The moment they come to the city, what they do, they don't take them to school. They turn them into maids. So that is an abuse. These kids do not eat. They are overworked. When they get sick, they are not taken to the hospital. That is already going against the Children Act, which is the law that protects the rights of children. And in that sense, you're supposed to be arrested and prosecuted for neglect or abuse of children. And if you are found that you've been trafficking children or exploiting them, then you are taken into court that you have gone against the Trafficking Persons Act. And if you are found to be guilty, you can even be jailed for 30 years, or you pay a fine of 30 million, which is equivalent of $20,000 or both. So that is how serious it is. But we know that the African culture, we are communal. Personally, my brother, who is after me, he died in 2013, and I've been taking care of his kids. And that means that you have to go extra mile, make sure that these kids are properly taken care of. One of the things that our brothers and sisters need to do is to make sure that these kids go to school. So the neighbors, they are able to tell and see these things. The neighbors, they know my brother in as much as he was not living with me, but they will know that this kid is Aggrey's brother. They will see when you are taking care of kids properly. I'm not saying that you take them to very expensive schools. Again, it depends with our ability. For example, I am in Korogocho, where I am poor, but I have my kids' brothers and I'm staying with them. I provide them with the services and care just like my own children. If my children are going in an informal school, let those kids go to that informal school. If my kids are eating one meal a day, then everybody else is eating one meal a day. If my kids are washing utensils, let those other kids wash utensils. So the moment there is a discrimination in terms of the kind of care you are giving them and the kind of things that they are doing in their house, they are not going to school, that is a big red flag. And whether you are staying with them, anybody who says this, call 116.
That really helps because I was worried about people who are honestly helping the children, and then all of a sudden they're thrown in the court system. So having been so involved in health related issues, but also from a communication level, would you say that your work is related to public health? And how so?
Yeah. I would say definitely it is related to public health. Like I've told you, child trafficking, for example, I'm talking about child trafficking. Child trafficking is the mother of all child abuses. And part of the things that these children go through, emotional, so they have mental health issues going on. We have kids who've been sexually abused, so they have other diseases going on. We have those who've been pregnanted. So many other public health related things going on. Right now, we are in COVID-19 pandemic, and we know the kind of lives that these victims are living in very crowded places. So they are, if I am at risk of COVID-19, a victim of child trafficking is even at a much higher risk. So any public health issues that we are facing in a community, children who are trafficked or going through neglect and abuses, they are even at a higher pedestal in terms of being at risk of those public health issues. So I will say that my work is the public health issues, and that is why I am connecting everything that I do. I go back to health, and that is why I ended up taking care, dealing with maternal and child health, and actually come up with a telemedicine project that won me the Rolex Award in 2012. I've done a number of tuberculosis, both communicable and non-communicable diseases interventions, because I realized that these people that I've been working with at the community level, they are going through these health challenges as well. And I can never ignore health issues when developing and designing interventions.
Awesome. One of the initiatives that you have, and I recall you've talked about it before, is the training of traditional birth attendants. And that is a topic that I really hold dear, because we tend to sort of want to push that under the rug and say everybody has to be a trained or a skilled birth attendant. But we know that communities will want to work with people they trust. So could you tell us a little bit more about your passion for training traditional birth attendants and also addressing maternal health issues?
Yeah, so we have the Western education and we have the non-Western education, and the traditional birth attendants are actually the non-Western education way. So I can say even our forefathers, they were educated on these issues without using the Western education. And one of the things that came out that they did so well also is the traditional birth attendant issue. And because over time we've been doing it, and they've been doing it perfectly well, and they know the telltale signs, and they know how to take care of women when they are pregnant and during delivery. And so many people, especially there's a big generation like my mother's generation going backwards, that actually most of them were taken care of by traditional birth attendants. But again, we also know that these are people, they are very, very critical in our communities, but at the same time, they are getting some challenges. So in Korogocho, for example, we had traditional birth attendants. So many women were still going to traditional birth attendants to deliver because of the obvious reasons. One is in Nairobi during those days, now at least we've done our advocacy and we have hospitals closer to the slum communities. At the moment, from 2013, going to deliver in a government hospital is free, but before 2013, it was really costly. And so there are so many push factors that were pushing women to continue going to deliver in a traditional birth attendant, in spite of the challenges and the risks that they will face when they are delivering at the traditional birth attendants. So I did a research. Actually, it was my master's thesis, which was on maternal and child health. And one of the things that I realized, I called it the 3 delays at that time. So for a woman to make a decision to go and seek skilled care at the hospitals, there were 3 delays that worked against them. So the first one is at the household level. So it is economic, you don't have money. It is cultural, so we have those people who believe that you don't go to the hospital, you take care of your health issues locally, or it could be gender-based. So sometimes you find that the household head is a man, and they are the ones who are going to make a decision. And actually, from my research, I found that there is another person who is very influential above the man. So you find that mothers-in-law were very, very influential. So a man sometimes will make decisions based on the advice that the mother has given out. And if the mother believed in this way of doing things, the traditional birth attendant's way, then you'll find that the husband also conforms to such kind of advice. So all this ended up contributing to the first delay. Then the second one is distance in terms of accessing health facilities. So you find the road network is not there, transportation is a problem. Then the third delay, which is now at the hospital level. So you find that we have inadequate trained medical personnel, or perhaps the hospitals are not adequate and they are very far away, or even there are no facilities within those hospitals, or even there are no medicines. And because of that, you find that in one hospital, there is one doctor serving so many people, and there are a lot of queues, and you find people really suffering. And because of that, you find that people still continue to go to traditional birth attendants because of this so many delays that they are facing. But again, we also know that sometimes people face pregnancy-related complications that can only be addressed when you go to a hospital. And in such a case, if you go to a traditional birth attendant, then that became a big factor that led to the high maternal and neonatal mortality that was faced in slum communities like Korogocho. And because of that, then I started looking, these people are very influential. How can we now start training them so that they can be able to identify these complications in good time, so that when they project that woman X is pregnant, and by doing all those checks, physical checks, by looking at their fingers, you can see the level of blood circulation. You look at their feet, you can see whether they are swollen or not. You look at their eyes, you can see how then those are telltale signs that something is going on that is not good with this pregnancy. And so you don't wait until it becomes an emergency issue. At that time, you can refer this woman to seek skilled delivery. And that became the essence of my project and my interventions, to train them. And actually, when we were training them, they said, okay, now we can change our name from TBA, which is traditional birth attendant, to SDA, which is safe delivery advocate.
That's wonderful. And it's exciting to see just how much of an impact you had. And I believe your project was also taken on by the government, right? Yeah. And the training was spread out to the rest of Kenya. And this speaks volumes again to the importance of involving government, or the government being involved in such grassroots efforts, because then it can help with the scale up and the sustainability of such interventions, right?
Sure. So actually, one of the things that I relied on, and that is one of the things that I tell people when they are coming up with interventions, don't do it alone. And that is why the 5P is talking about partnership. And the key partner that you must always have is the government. So look at the government structures that are there. And within the public health, we have what is called community health strategy. And within the community health strategies, we had what used to be known as community health workers, which are now CHVs, community health volunteers. And that is why I wrote on. And I also trained a few. Actually, I trained 18 at that time. The government of Kenya came on board and trained 350 in that community. So that is how, when you work with the government, that is how successful your interventions can be. And now, as we speak, we have a health facility inside Korogocho. So you can see even the distance had been addressed by the government. And when Uhuru Kenyatta came in 2013, the wife came up with almost the same concept, but in her case, he came up with mobile clinics, which she ended up doing a lot of campaigns and raising resources. And now we have those mobile clinics in every county. So, and again, one of the biggest things that they did was to make sure that going to the hospital is free. It took care of all the challenges that we are facing.
Wonderful. So it's good, you were able to make such a difference in your community. And you alluded to technology, and I'm also very drawn to utilizing technology to make a difference in health. So when you look at communication, technology, and health, those are really key factors in, changing behavior and also enhancing social change. So what else do we need to know about that relationship between technology and health?
Yeah, in the past, when we were going to do interventions in the community, people were thinking in terms of face-to-face. So even this interview, perhaps I would have been sitting within one room, and then we talk about these things, and then you record and transmit them. But because of technology, we can be in so many different parts of the world, and we talk about these things and come up with interventions, monitor, and bring change. So right now we have smartphones, which everybody is having. So the moment you have smartphones in your pocket, you have everybody. So people can be reached instantly. You can monitor people with their knowledge or without their knowledge, and you can know their behavior. And that is happening. And because of these kind of technologies, we are also able to identify those who are abusing people through technology. And we can tell with almost 100% certainty where they are. So technology can help us to do all those things. And at the same time, technology can also help us to mitigate against health issues. And one of the things that is happening right now very well is COVID-19 pandemic. And this is a very good example. If you go to Korea, I don't know whether it is South Korea, I can't remember, or North Korea. But one of the things that they are doing is to monitor people, for example, through ATM cards. So like here in the US, all of us are making use of debit card. So you either make your payment through debit card or you go to the ATM. All the transactions are through plastic money. So in that country, one of the things that they've done to do contact tracing is to look at your ATM cards, how you've been using it, and they can tell where you are. And for example, if you go to a bank and you leave alone even bank, you are with a mobile phone. Your mobile phone, the moment you've turned your GPS on, we can know that Aggrey today is in Athens. So by us having a look at that, especially law enforcement and the government, they're able to tell there was a big event that happened in Athens. And through that event, X number of people ended up turning positive for COVID. So how are we going to tell who was there at that particular time? Actually, we don't even need to start asking people who are you sitting with. We just go to technology, GPS, and we're able to tell XYZ were there. So we are that specific. And through that, we can now reach their phone, text them, hey, we need to come for COVID test, or we need to be isolated. And actually, we can tell through GPS whether you are being isolated or not, because we can tell who else is coming close to you. And that is possible because almost everybody is having a smartphone in their pocket. And that is how, when we take advantage of that kind of technology, then most of the things really become super easy when you want to implement them. Of course, some of them have legal and ethical issues, for example, confidentiality issues, privacy, and that is why they're not being done at scale. But there are some countries where sometimes they can be a little bit dictatorial and they enforce them. And we've seen that they've been able to do a lot of contact tracing, and through that, they've been able to mitigate against the spread of COVID-19. But those countries that were highly democratic, where you give people room to start telling you that they feel uncomfortable putting on face masks, or they're not going to be vaccinated, yet we know that vaccines work, then when that kind of room goes on, then it means you are not mitigating against it. But we know those who've been able to make use of technology to address these things and to nip transmission of diseases such as COVID-19 at a very early age.
Awesome. So when you look at all your work and your desire for good governance, what are the policy implications for the work you've done, and what else would you want to see in terms of enhancing that social change and good governance, and in also ensuring that child and human rights are enforced?
I usually say that policy is a purposive course of action that you want to do to achieve positive results. And policy can be at the level of an institution. It can even be a level of household. So within your home, to say these are the policies that will follow within this household. That any visitor who comes in or anybody who comes into my house you must put on face mask if you are a guest, for example. So that can become a policy at that level. Then we have institutional policies, for example, universities and so forth, or organizational policies, or it can be national policy, which is backed with laws and such kind of things. And that is the most important policies that I want to address now. Because when anything is not enshrined in policy and is not in law, then it means we cannot hold anybody accountable. We cannot push policymakers, that is my Luo pin coming out, push. So we cannot push the policymakers to enforce, to do budgetary allocation, to allocate resources and facilities. For example, in Korogocho, we did a lot of policy advocacy, and they ended up coming up with a health facility because we had some policies in place. And actually, one of the projects that we did, we even took a local policy leader to court because there were some funds that were allocated to his office, and these funds were misappropriated. If you look at the government documents, they had indicated that XYZ had happened. They accounted for it. When you go to the ground, it was zero. What Kenyans usually say, when you come to the ground, it's tofauti. So it was tofauti, went to court with evidence, and we ended up showing that nothing happened, and actually the courts ended up demanding that they pay back the money and they do the actual thing. So that is because of policy. So sometimes you have policies like those ones that can help us to hold people accountable. But sometimes we miss out and we don't have policies that we can hold people accountable. Or sometimes we have policies, but they are not enforced because of so many other factors. So now when I come in is when we discuss, during our community conversations or meetings, and we realize that this work, it must be tied to a certain policy. Perhaps the policy is not existing, or it is existing, it is not enforced, or there's no policy. Then that becomes the starting point of our policy advocacy. One, create a new policy. For example, child trafficking. Before 2010, there was no law. We pushed, and now we have Trafficking in Persons Act. And through it, we can arrest people. They can be charged 30 million Kenya shillings if you are found guilty. Witnesses can be protected, and victims can be given some money out of some kitty because we have a law. But now sometimes the law is not well enforced, then that becomes another type of advocacy in terms of now pushing those who really matter to make sure that the law is enforced and followed.
Indeed. Policy helps again with, making sure that all these initiatives reach the larger masses, but also ensuring that they are sustainable, because we are able to hold the governments and the policymakers accountable. So you're now in the US with your family after relocating them after a few years ago. How has the transition been?
Yeah, so going to a new environment has its own challenges. So one is, for example, education. You find that my kids were following the 844 system in Kenya, which is slightly different from the system here. They were exposed to different cultural and social issues back home, which is now different here, including even food. So once they got here, so they have to make that drastic change in terms of them to start adopting the new environment and start going to school. But again, so there have been positives and negatives that they have experienced. So the positive one is they like the schooling here, partly because in Kenya, corporal punishment is illegal in the country. But still, we know of teachers who still do corporal punishment, which is illegal. And right now, because of this banning of schools, I can see people online agitating that kids should be beaten up by their teachers and by parents and so forth. So here, nobody is beating them. It is being enforced. In Kenya, we have a law not properly enforced. Here in the US, it is properly enforced. No teacher is beating anybody. So that one, they really like it. Then I think the other thing is that the way they've been really fit in here. So one of the things that I did strategically is for me to come back to Higher University. Actually, it informed me coming back to Higher University because I've been here for my master's. I have very good, strong networks here, and I know the community very well. So it is an international sort of a community. And so I knew that the moment my kids come here, they are able to reach out and be friends with others from Africa and as well also expose themselves to other people from other continents like Asia and whatnot. So that is another positive. They've been able to network and they have friends all over. So actually today, Junior was telling me that, hey, Daddy, somebody has a crush on me. Yeah, so I have to engage him because of that. So again, that is the system here, different. So here, somebody having a crush on you. So they have been trained on the good touch and the bad touch, and they know how to speak out. And back home, perhaps my kid would have been telling me that somebody has a crush on them. So I'm able to intervene, especially if somebody is going out to start exploiting or abusing them. So those are some of the good things. But again, here also, I have very good professors like yourself and others who've been really supportive. And especially when my wife came here, got a really great support from you and others. And so she was able to fit in. So I can say that we've not had any challenge. We really smoothly fit in. And because of that, it really helped them now to become Americanized. So I can say my kids, with me, I still have my European accent. And once in a while, the Fizz thing will come out. But at least with my kids, they've been Americanized. So if you speak to them, the accent is American accent. So they've been able to become assimilated.
Awesome. It's very nice to see them, enjoy the system and do really well in school. One of your sons is very active in football, or what they call soccer here. So it's really good to see how he's championing.
He is one of the top scorers. They became champions locally. They got defeated when they were just about to get the state level, which is a very high profile stage. And as we speak today, he is now, the season for soccer has ended and they are the champions. Now he is part of the wrestling team, something that I never imagined that my son. So the moment he came in, he went into the wrestling team immediately within 1 month, and he won a very big trophy, longer than himself. And people started saying that is Ugali from Kenya and Samak. So today they've started being part of it. And it is really interesting that part of the system here really identifies this talent at very early age, and they are able to nurture them.
Great. And I brought up this topic given, the concern we have with child health and seeing how important it is for children to grow and to be part of a thriving communities. And so it's very commendable of you and your wife, Jackie, for what you've done to help your children get to where they are. The one last question I have before we end this today, you're still considered an international student, an international person. What kind of advice do you have for, other people who are in your place, people who are experiencing the same things you are experiencing?
First of all is I know a number of people, especially my guys in Koch and similar places in Kenya who also want to come to the US. One of the things that I usually tell people is when you see Dr. Kingori thriving, don't say that I want to be like Dr. Kingori, because you don't know her story and how she has worked her way to where she is and the kind of sacrifices that she has made and the kind of decisions and the social support system that she has had. So that is one thing. So I usually tell people before you embark on anything, you have to really think through and be strategic. So like in my case, I was lucky to get Ford Foundation scholarship in 2008. Then I came here in 2009, did my master's, but I decided to go back home. My friends and some of my classmates remained behind. They did their PhDs and now they are professors, and others went into other things and they are now US citizens. But I made a decision to go back home because of the family. But again, you can see from 2011, it took me 10 years for me to think about pursuing my PhD. And it was deliberate because the reason is my wife at that time, she was a high school certificate holder. So I have to work, make sure that I support her to finish her undergrad so that when I go for my PhD, she has finished her undergrad so that the gap should not be so big at the home. And I'm happy that now she's thinking about her PhD. So at some point, we'll be all professors at home. So that can inform the kind of decisions that I was making and the kind of thinking through and the kind of networking that I've been doing. So that is one advice, is think through, network, do your research, know where you are going. Coming to the US is not like all glowing. So sometimes you can come here and you'll meet some challenges that will make you wish that you go back home. I know of a student who came here in January And by March, he went back in Kenya because he had high expectations. He didn't think through what he was going to do. He left his lucrative job back home only to come here and found that he doesn't even have scholarship. He has to pay out from his own resources, and it is very expensive to live here if you don't have scholarship or if you don't have a job. International students, you are limited in terms of the kind of jobs that you can do. And so it means you have to think through these things. So my advice actually is think, and consult, especially those ones who are where you are. If I want to get to where Kingori is, then I need to consult, to talk with her before I start thinking becoming of Kingori, so that I can understand the path she has taken. And perhaps she can advise you. You can take a shorter route, or you can take the long route, the way I did, and then you can really get informed decisions that you can make to do what you want to do. So that is one of the things that I can really advise people to think through.
Well, I want to thank you so much for coming on and speaking with me today. You have achieved so much over your lifetime. Even though you took 10 years before deciding to do a PhD, what you've done in those 11 years is impeccable. And the changes that you helped bring to your community in Korogocho. And we know that you're still giving back, even though you're here in the US now. So I want to commend you and to congratulate you again for achieving this status of being a doctor. And I know your desire is to be a professor, and you're headed there, and it's really exciting.
Like Dr.
Didn't you just say people should not say that?
I'm consulting you behind the screen.
Yes, I mean, we've definitely been talking for a long time, and you've asked very good questions to know where you're headed and what you want to do, and I am a witness to some of those successes. So, good job, good job. I'm shaking your hand virtually for this far you have come. So, thank you again, and I want to thank all the listeners and the viewers for listening in. And if you have any questions or follow up, how can people get in touch with you, Dr. Otieno?
I am all over social media. So I'm on Facebook, Aggrey Willis. I am on Twitter at Aggrey Willis. I am on LinkedIn, Aggrey Willis. I am on Instagram at Aggrey Willis. And you can also find me aggrey.willis@gmail.com.
Wonderful. So I hope people reach out to you and pick your brain because of all the community-related work you've done and your participation and contribution in social change as well as good governance. And I want to encourage everyone to subscribe to the podcast. We are on multiple platforms where you can listen in on your podcast, but we are also on YouTube. So check that out as well, and feel free to reach out to me if you have questions or if you have topics that you would like discussed on this podcast. So thank you, asante sana, Dr. Otieno, and I hope to follow up with you and see what else you have going on as you continue, expanding and growing in your career. Thank you.
Thank you for having me.